What happens when you don't ask questions? So I'm Dr. Rahi Victory, reproductive endocrinology and fertility specialist, and we're going to talk about what happens when you don't know what's going on and don't ask the questions, and also don't advocate for yourself. When you're going through fertility, most people have no clue what's going on. They're at the fertility office or doctor in order to find out what's wrong. So number one, you deserve answers. There's going to be testing, and then there's going to be results. And if you're not getting those results explained to you in language that you can understand, then you won't understand what's going on. No matter how good a job we do helping you get pregnant, if you go through the process without knowing what's happening, I guarantee you it's going to have some degree of trauma, emotional, mental, or financial, because you didn't know what the steps were, why they were happening, when they were happening, how they were happening. So it's really important for you to understand exactly what is wrong with you. How do you do that? You got to ask. Should you have to ask? No. In a good fertility office or clinic, the doctors will know enough to advise you on every single thing that's going on with you. Here at Victory Reproductive Care, when we get your tests, I literally read them out to you line by line, explain what each and every single test means. You need that level of care. Why? Because like I said, if you don't get that level of care, you're walking away confused, frustrated, possibly annoyed, and definitely anxious because you don't understand what is going on. The other part is that when it comes to treatments, you need options. No one should be told this is the only thing you can do, because there's always options. Options might be as simple as no therapy or IVF, or it might be no therapy, IUI, IVF, and surgery. There's loads of options available, but there's never just one option. So make sure that you are asking for options. If they're not giving you option, you got to be wondering what the motivation behind not getting any options is, because there is always an option available to you. And you've got to be able to consider the risks, the benefits, and the costs of each and every option. If you don't, you're not really getting appropriate care, are you? You're not understanding, again, what your choices are. You don't understand the risks and benefits of them. More frustration, more stress, and probably a lot more cost than you needed to go through. So make sure you understand what your options are. And then finally, make sure they're going through what the outcomes are going to be. It's great to tell someone that you think as the doctor, I can get you pregnant with one cycle of IVF. This is going to be a slam dunk, no problem. But if you also don't explain to the patient that that slam dunk actually means they've got a 65% chance of walking away with a baby, when they're not successful, they're going to be saying, wait a minute, you said this was a slam dunk. And it's kind of late at that point to say, well, I actually meant you had a 65% chance. So advocate for yourself. Ask specifics. How high are my chances? Exactly what are my outcomes going to be? How long is this going to take? How many tries am I going to have to put into this? How much is this all going to cost? All of these things are really critical for you to understand. There's a brilliant Israeli study where they brought women in who were admittedly a little bit older in their reproductive age, and they sat them down and they told them, you have a 5% chance of success. And as the women exited the clinic, they had them sit down and fill out a form, and one of the questions was, how high do you think your chances of success are? And the average was 49.3%. So even though they were told it's 5%, they were walking out thinking it was 10 times that level. So it's really important for you to advocate for yourselves, because even when we say it to you in the clinic, it doesn't always register on the first try. We have to do an amazing job of educating you, of informing you, so that you can make a decision that is right for you. Never accept cookie cutter medicine. We're not baking cookies, we're making babies here.